afternoon, everybody, and welcome to the final session of siberXchange 3.0 Day 4, focus being on healthcare. Before I begin, I want to thank the audience for joining us from around Canada, in fact, from across North America and the world. I also want to thank team members from Juniper, from Darktrace, from Sentinel-1, and all of the other partners that have come to this conference presenting their ideas and responding to a variety of challenge statements. My name is Ali Hirji. Well, actually, it's Ali Abbas Hirji, but you can just call me Ali. There are actually more names that I could add to that. And as you all know, not only am I the host of the opening talk show at siberXchange 3.0, faculty and lead of the AI Hub and the Center for at Durham College. And for this final session of the day, as we discuss healthcare, we're going to be looking at a trend around telemedicine, virtual care, and looking at some of the privacy and security concepts all of us need to pay attention to. Earlier in the day, I mentioned that security is not about answers, it's about questions. So bring your questions, drop them in the live chat, pay attention to the ticker playing below with all of the data points, and I'll be more than happy over the next 60 minutes to bring it to my esteemed guests. Now, before I begin, I think it's extremely important, besides acknowledging the fact we are all working and operating within a Canadian context, it is important to recognize that this virtual conference is also coming to you virtually, and the virtual space also constitutes Indigenous space. Cable network, our fiber optic network, our wireless networks all run across this land. And it's important for us to acknowledge that. Give to the earth, and it gives back to you. I thank all of our sponsors, our partners, and our panelists for giving back and sharing in their education and in their learning. Let's jump into this topic with a very brief 10-second context. For those of you that are watching, many of you probably remember the documentary on Netflix, The Social Dilemma. Let's take one quote from The Social Dilemma. It's an interesting one, probably even a controversial one. The individual said, and the name defeats me, the individual said, there are only two industries in the world that refer to their consumers as users: narcotics trade and the software trade. I happen to be in the software trade, but that definitely got my attention. The reality of the matter is, data sitting in digital architecture, data sitting on software, data, that too healthcare data, in a software environment needs to be thoroughly understood from a security and a perspective. Said earlier on today in the first session, you may go onto the dark web and you would find credit card details, for example, selling at $5, healthcare details selling at 5 or 10 times that price. Why? We will learn more as we move along. So, please join me in welcoming my panelists. First one being all the way from Alberta. I'll be taking a flight from Ontario, getting all the way to Alberta and welcoming the Privacy Commissioner, Jill Clayton. Jill, I want to thank you for taking the time, and more importantly, can you introduce yourself and tell us what has the impact of the pandemic been on the delivery of virtual care? Jill?
Sure. Thanks so much, Ali, and thank you so much for the invitation to be here. I'm quite delighted to be able to participate all the way from Alberta. So thank you very much for that. And yes, I'm the Information and Privacy Commissioner of Alberta. I have been since February of 2012. So I'm actually in my 10th and likely last year as commissioner. So again, it's just a real thrill to be here, to be part of this event. Yeah, and thank you for that question. I think probably one of the things that we have focused on really, it's been a huge priority for us, and number one focus for, let's say, the last year and a half or so is privacy considerations when delivering virtual care. Of course, during the pandemic, we saw an almost overnight adoption of a number of virtual healthcare technologies. Obviously, healthcare professionals were not able to see patients in their offices, and so they were looking for ways to use technology to provide care to patients, and whether that was by telephone or by video conferencing. I mean, we all started to use Zoom, Teams, and other sorts of video conferencing technologies almost overnight, or through smartphone apps for that matter. And so I think probably one of the biggest considerations in Alberta, for those who are participating, you might know that we have standalone health information legislation here called the Health Information Act. And under the Health Information Act, healthcare providers, which we call custodians, are required to submit privacy impact assessments to my office before implementing new information systems or administrative practices that have something to do with the collection, use, and disclosure of health information. And these sorts of new technology applications are exactly the sort of thing that would normally trigger this requirement to submit a privacy impact assessment. So early on in the pandemic, we were asked, well, everybody's introducing these new technologies. What do you want us to do? I was actually asked if I could waive the PIA duty, which of course is something in the legislation. It's a duty in the legislation. So of course I can't say, no, don't comply with the law. But we did publish a statement on our website and said, I get that you might not be able to give us a full-blown privacy impact assessment, but at least notify me about new practices or information systems. And something like, so this is one of the most significant impacts early days of the pandemic. I think we ended up with 150 either full-blown privacy impact assessments or notifications to me within just the first 2 weeks. And I think now we're well over 300. So it's not that there's 300 new technologies necessarily, but these are custodians with obligations under the legislation who have to tell me about a new technology they're implementing. So I'll just really quickly say that we tried to provide some guidance to custodians. We worked with the College of Physicians and Surgeons as well as with the Alberta Medical Association to provide some guidance on virtual care solutions to healthcare professionals. And they communicated that guidance widely through newsletters and on websites. And I'll just say that there are a few, and I can go into more detail on some of these, but some of the key issues that we think healthcare providers need to be thinking of with these technologies. Number one, around identity verification and notifications. So how do you confirm the identity of a patient in a manner that is privacy, respectful of privacy? When you're using a virtual technology, how do you tell patients about the virtual care solution and make sure that they understand any risks to using and communicating with this sort of technology? Security of the data. Obviously, there's some security issues around transmitting data. We're looking for end-to-end encryption, just other kinds of concerns around whether or not interceptions of communications, whether or not screens can be shared without physician or patient knowing. I think another topic I'd just like to touch on really briefly is the use of service providers. So that's another pretty key issue that our guidance was addressing. So a lot of these new technologies, it's not just the healthcare provider, it's the healthcare provider has a relationship with the software provider, with the technology provider, with the app developer. And so there are relationships there and information that is crossing borders. So that's just a few of the key issues that I think we've seen as a result of the explosion in the use of these technologies tied to the pandemic.
Absolutely. And I think one of the really important points that you brought up, there was some of the elements around security and how we build software to deliver telemedicine care. Now, one thing I picked up on was on the identity piece. And I often, when I talk to my students, I tell them, the existential statement that I connect, therefore I am, does not hold true. Because the way passwords are shared, passwords are compromised. Just because somebody's logged in, how do you actually know that that is that person that you need to be delivering care to or sharing data with? Something that I definitely want to unpack as we go through this session. So thank you as always, Jill. I'm going to now teleport back to Ontario. And first, I'm going to go to Ritesh, and then we'll go to Ali Mohamed. Ritesh, looking at your mic and your setup, I was about to say somebody give that man a show, only to realize the person that I'm talking to is a celebrity and has been on many, many major shows when it comes to discussing cybersecurity. Ritesh, thanks for joining us. I know this is your first session on siberXchange.ca and my first session with you. Ritesh, could you comment a little bit on, do users actually understand, especially users and patients that have had to move to virtual care for whatever reason, primarily driven by the pandemic, are they actually aware of some of the security and privacy concerns that have now? Ritesh, your perspective.
Sure. It's just really hard to follow the privacy commissioner. She was, she sets the bar really high for us. But first of all, it's a pleasure to be here, and thank you to everyone for who's been a part of the organizing and also having me. This is it's a privilege to be here. So I'll need to answer your question. I think the answer is really simple. I think it's no. I don't really think people really understand the security concerns, the cyber concerns, the privacy implications when it comes to leveraging net new technology. Actually, we just teleported from Alberta back to Ontario. Well, and I hate to do this to people. I'm going to teleport you back to March of last year. And when the pandemic happened, the pandemic was already going on, but when kind of the world shut down and a lot of organizations were just forced to do something net new that they never really thought about. They might not have had business continuity plans. They might have not really thought about what happens when their doors close, when they go from a physical environment to a completely virtualized environment. And as a result, it was, let's just take tech to solve the problem. I call it the band-aid approach, stop the bleeding. That's the triage element of this. And that is what we saw. We just saw people using in the medical space, but also in other sectors as well. In some areas of particular sensitivity, just using systems and software that weren't encrypted, that did not go through a rigorous privacy. They didn't do any privacy impact assessments, so there were no PIAs done. It was just simply stop the bleeding. And I get that, and I empathize, and I also understand that a lot of these providers aren't major providers. They might not have IT personnel on staff. They might not be thinking about security in general. They might be a single individual running a small practice, or just a couple individuals, and they never really thought about the implications here. It was just, how do we keep the lights on? So as a result, and not only were these practices, these doctors, these caregivers in that situation, so were us, like members of the public. We were scared, we were worried, and when you needed access to certain information, it was just, give me that access. I need it, and I need it now. So we didn't really think it through. So the answer was no. Now that changed, obviously. Different groups, different organizations started putting out more clear language. There were directives that were put out. Cybersecurity went front and center, especially when people started getting Zoom bombed. And if we remember that, there was this poor student giving her defending her PhD, I think at Duke or Yale or one of the Ivy League schools, and all of a sudden she gets Zoom bombed, right? And stuff that we never really thought about before. And there was this influx of net new technology that tried to fill in the gap, everything from wearables and biometrics to digital everything, smart everything. It was, how do we stop the bleeding? So we really put the cart before the horse, and now I feel like we're trying to play a little bit of catch up. And there's more challenges coming as well. Now we're moving into a bimodal workplace, into a hybrid environment where you got to be as secure in the physical world as you are in the virtual world. But this is a lesson, I think, to a lot of organizations and a lot of individuals when it comes to cybersecurity and it comes to privacy, is that you got to think about these things. You got to have contingency plans, and it cannot be an afterthought. It needs to be baked in right from the beginning on everything that you do, because things are going to go sideways. And when they do, you got to have a plan, and it cannot be, especially privacy, cannot be put on the back burner. It must be built in by design.
Absolutely. And I really appreciate you bringing up both security by design and privacy by design, simply because it's not an afterthought that you have to think about this, but you have to think about security and privacy not as something that you add on, but as many experts say, as a prerequisite to the tools that you're deploying. As always, thank you, Ritesh. And Ritesh, I know how both you and Jill, extremely busy schedules. Once again, I really appreciate not just your introduction, but the way in which you've set context for. And Ritesh, from wherever you are in Ontario, I will board a train and head up to the city of Pickering and meet with my good friend, partner at Durham College, Ali Mohamed from Lyte Medical Clinics. And Ali, if there's one thing that I can say about you, though your company is called Lyte Medical Clinics, you do not take it lightly at all or make light of privacy or security. You recently launched a demo of your telemedicine platform, and you're going down the path of releasing a custom build, a whole bunch of features in it. One of the things that you did upon launching your platform, you looked at your internal resources and you added an administrative process, you added an operational process. You took the deployment of your MVP slowly and steadily and actually individually managed each one of your telemedicine platforms. Why was this super important for you, Ali?
First off, thanks for having me. I'm really excited to be here, both Ritesh and Jill. I swear, every time I do these sessions, I learn so much. It's like I come on here and I'm informed more and more by just the people on the panel with me. So thank you for having me. It's great to be here. You know, Ali, I'm an entrepreneur, right? So I don't have a tech background. I don't have a healthcare background. But for me, it was I fell in love with this space because we had the ability to help. We had the ability to help people when it came to different things. We had we had the ability to help people get better access to healthcare. You know, we've been a telemedicine clinic since 2017. We've just gotten to the brick and mortar space in the last few years. So one thing that was always lacking in the space was the technology, because essentially nobody even believed in telemedicine. Well, not believe, but nobody used telemedicine because back then you couldn't bill for telemedicine. So we've had issues with using EMRs and different systems throughout our journey and throughout our inception. So for me, we really didn't have a choice. For me to really make sure that this vision and this goal and this dream of mine kind of made sense and worked, was we had to implement our own technology and we had to bring it all in-house. And for these reasons, we had to be able to make sure that the product wasn't being third-partied out somewhere else where the security wasn't being thought of. We had to make sure that all the data that was being written in our region and being held under very secure and very scrutinized members of our team. We bring in each individual member of that team to work specifically on certain elements of the build. And as you know, we've engaged Durham very aggressively for certain elements, and that has helped us tremendously. We've worked with students, we've worked with endless staff, endless members of your team to continue to grow out the platform. But for us, it's always been focused around security first, because we've seen what happens when there's breaches in the space, and we can see how catastrophic it can be for anyone involved. Right now, we have partner clinics that are on board. So not only are we hosting our own data for our own 3 clinics, we're hosting the data for a multitude of clinics. So the focus always has to be security first. And honestly, the best way to control it is by bringing it in-house. And I do thank you and the team at Durham and everyone there for all the work that they've done, because I truly believe that with the 4 years of experience and with the team that we have now, we'll be able to bring something to the market that's very valuable, very secure, and very easy to use. I think a lot of times when it comes to technology, we get a loss of adaptation because of how finicky it can be, or how many clicks a person has to do, or how long it takes them from point A to point B. I think when you take in everything from the doctor point of view, the patient point of view, and the security point of view, if you consider all those things together, you can build a pretty powerful system. And that's what we're doing.
Absolutely. And I think, you've raised an important point here, and I really want our audience to appreciate this, is that often when we think about security in these DevOps environments, we tend to think of it purely as a technical play. Without a doubt, there is a technical acumen that you need in order to understand what are some of the loopholes that exist in some of the code base that you're using, so on and so forth. Like on the first day when I spoke about XSS scripting, right? You need to understand some of those things, but there's a people and a process piece to that, and in that order: people, process, technology. And I do commend you, Ali, for getting the people and process piece in place and then allowing the technology to come together and going, as Marge Simpson would say, slow and steady to win. Good on you, Ali. Jill, I'll come back to you and drive home a little bit more conversation around the concept of telemedicine. Now, there are numerous elements that constitute telemedicine. One of them has to do with actually viewing your doctor and the doctor seeing the patient virtually across a camera. From a privacy perspective, can you help our audience understand what are some of the things that you look for in that moment when a doctor is meeting with a patient through a camera? Are there any particular privacy notes you raise for the service delivery providers to keep in mind? Jill?
Yeah, I think that's a really good question. And actually, before I answer that, though, can I'd just like to comment on Ali's,
Absolutely.
just talking about being really broad in terms of, people and processes and places, just because it's not always just about the technology. It is very much around the processes and making sure that people understand the processes. And, to some extent, now sort of shifting to the question that you asked me and giving you a response to that. I mean, one of the very first things really is around making sure that you do have the right person that you're talking to, and obviously there's a way of doing that when you are connecting with somebody in real life. When a patient shows up and attends at a clinic, you can You can ask them for identification. You can verify identity in a number of different ways. And I think a lot of the same rules are going to apply when you are doing this online, when you're doing this in a remote situation. The rule in Alberta, in our legislation, is that you are limited, you're prohibited from collecting more information than is essential to meet the custodian's purpose. And if the custodian's purpose is to provide healthcare and to verify identity, then you've got to be thinking about what are your practices going to be around making sure that you have the right person that you're dealing with. And there are all kinds of guidance documents out there and professional standards around doing that. I mean, to some extent, we're talking about the pandemic as a catalyst, and there's this explosion in these new technologies. But a lot of physicians have been providing care by telephone for years and years. So video conferencing is a little bit new and different, but there are already established processes. And if you look at various groups, in Alberta, for example, the Alberta Medical Association, the College of Physicians and Surgeons, Alberta Health Services has guidance out there for providing remote care. The Canadian colleges have national guidance. There's a group out of BC, something called Doctors in BC or something like that. And they have a great virtual toolkit. And there's lots and lots of different guidance that is available to help practitioners navigate this new environment if they're new to the idea of providing telemedicine or virtual care. So obviously, one of the first things is identifying patients. I mean, I would look to your professional standards and find out what sort of guidance is around there, keeping in mind those basic privacy principles of limiting the amount of information that you need to collect. And I think also there's another issue, and we haven't really touched on this quite yet, but this idea that it's not entirely on the healthcare provider to protect information. I'm thinking about patients who are able to access their own information through a health portal, for example, or if you're recording information and storing it on your computer at home, for example, you may, as the patient, be putting your information at risk if you're not taking proper precautions, if you're using devices, for example, where you don't protect your own password, if you download apps from sources that are not trusted sources, if you're not following through and using secure messaging to transmit information, if you're storing information on your own system longer than you need to, if you're using public Wi-Fi, if you're having a virtual consultation from Starbucks or something like that, if you don't have virus protection on your computer. So that right, there's a whole long list of some of the challenges and the risks of providing or engaging in remote care. Some of them, there are safeguards that health custodians are required to have in place. They're required to safeguard information. They're required to have technical solutions and administrative controls, training, all of that sort of thing. But as a user, there are all these additional issues. And as Ritesh was also talking about, people who are working from home, and we have all of these extra issues when you're working from home and you're maybe not on a secure network and you're downloading information, you're transmitting information back and forth. We're starting to see that kind of thing turn up in breaches that are reported to our office, breaches that are associated with providing remote care, or just frankly just working from home, not even in the health sector necessarily. So hopefully that answered your question a bit.
No, it certainly did. And I would definitely want to add my 2 rupees of thought to that by simply saying something that I heard yesterday on a session, which was in fact a session was titled this, trust but verify. And even though you're supposed to be meeting a patient at this time, you need to verify and ask those verification questions. And it goes both ways, for the clinician delivering a service and also to the patient receiving that service. And it's important for patients to know some of their rights, so on and so forth. Which point I will add this is that if you are receiving services, I know Jill mentioned quite a few services and tools that are available to you. Ali and a couple of leaders across Ontario and across Canada are now coming together to put together the Telemedicine Association of Canada, which I hope to be a part of as well. And there will be a toolkit available to end users. And perhaps in the next month or so, if you go to the siberXchange platform, you'll be able to access that toolkit as well, because patients need to understand their rights in a digital ecosystem. So as always, Jill, thank you for keeping people first and advocating for the rights of patients. Ritesh, I'll go to you and then we'll go to Ali Mohamed. And Ritesh, one of the things that we hear a lot when it comes to, especially in my work, dealing with a lot of startups coming to the college, wanting to work with my graduate students, they talk a lot about, when I start talking to them a little bit about privacy and security, they see it as a very specialized task. When you ask them to do privacy impact assessments, when you talk to them about privacy by design, you talk to them about security concepts, it's seen as a very specialist task. And it's expensive also to get resources to do this stuff for you and to continue that process. Does this put innovation in healthcare and telemedicine at a bit of a disadvantage? How do you suggest that smaller companies trying to deploy new digital healthcare solutions navigate a fairly costly cybersecurity services space?
Yeah, so there's kind of two questions there, right? The first one is on the cybersecurity element, which is, I think, directly linked to privacy. If your stuff gets breached, then people's information is going to get out there. But then the second element of this is, kind of the fair information practices, or the way you kind of bake in privacy right from the beginning, or design it right in, privacy by design. And Ali, you bring up a very good point. It's if the cost is too high and it becomes prohibitive, are people actually going to do it and make it into a afterthought? To me, I think that there is numerous resources that are available when it comes to. It doesn't cost anything to think about privacy, or have a privacy advocate right at the table when you're trying to build any type of solution out. There are resources available. The Information Privacy Commissioner would have information. There's stuff on the federal website as well, under PIPEDA. If you go, there's resources for businesses, resources for individuals. Jill mentioned the information that she put out right on her site. It doesn't cost any money to go to her site, and it's publicly available information. I think the bigger question is knowing that these resources actually exist. It's actually getting the word out to small businesses, and this kind of comes into more of a communications exercise than it is kind of from a technical standpoint. It doesn't cost anything to understand that stuff needs to be encrypted, that you need to limit the use of the data that you have. So for example, if you're collecting the data for a particular purpose, that you don't repurpose that data for something else, that you build in consent, right? And meaningful consent. It's not just a super long legal document where somebody hits I agree and they're signing their firstborn away. It just doesn't work that way. That's not fair to individuals. So making things, we talk about access to justice, or access to education and to these tools. I think that is very important when it comes to shifting that mindset of this doesn't need to be an extremely expensive process. Yes, if you're dealing with very complex situations, you probably have a budget to bring in consultants and experts. But to have a mindset where you say everything that we do, we're going to put, we're going to make sure that it's legal. We're going to make sure that it respects people's privacy, and we're going to make sure that it's ethical. That doesn't cost you anything. Now, okay, Ritesh, then where are these resources? We mentioned the IPC, we mentioned the OPC, the Office of the Privacy Commissioner. That's the federal body. If you're engaged in any type of commercial activity, that falls under PIPEDA. So there are some rules under that. The Privacy Commissioner definitely has more information on that. But to me, these are government agencies that are there to help you. You also have tons of privacy blogs. You got access to different groups. I found the International Association of Privacy Professionals to be a fantastic resource that had tons of sample PIAs, sample policies also that you could access, checklists. This stuff doesn't cost much. I think there's a misconception that I got to hire consultants that are going to cost me hundreds of thousands of dollars. That's not the case. This is more cultural. It needs to be embedded. It needs to be front and center, and it cannot be an afterthought.
I agree with you 100%. And as you were speaking, I was remembering my dad, who often would tell me people know the price of everything, but the value of nothing. The invaluable resources that you've pointed us towards is extremely useful. So Ritesh, as always, thank you for sharing all those resources, and Jill, you as well. Now, Ali, I know I've been talking about price and the high price that security and AI and data services come at. I do understand, but this does not mean that my invoice from Durham College is to be paid in rupees. It is paid to be paid in Canadian dollars. Anyways, Ali, one of the things that you've done really well, and you've gone through this piece of being a startup, having to manage costs, raising funds, and then building your platform. One of the things that you've done is you've paid attention to what's happening in the market. One of the things that you pointed out to my team about 2 months ago were a couple of breaches at local hospitals where, for example, a nurse accessed resources without having the permission to do so, or a group of nurses or a group of doctors accessed information with no legitimate reason, and that could have been used for malicious intent, whatever else have you. What you did immediately was you came to us and started talking to us about access management, and you've gone down this path of looking at multi-factor authentication, biometrics, which questions that have come in about that. But one thing that I noticed that you did really, really well with the current medical practitioners that you have on your platform is you go through a reporting and a log process on a weekly and a monthly basis. That's time consuming for you, but I've seen you do that on your own. Why have you gone down that path of making sure reporting and logs are not just submitted to the client, the doctors, but also going through them to make sure there are no anomalies? Ali?
Yeah, it's you know what, we can never be too safe. I think that people need to understand that when a doctor is looking at a file, even that can be critical. So for us, I want to understand what's happening every week, every month, understanding, making sure that that patient's information isn't being shared throughout the organization, that the reason for the patient to be there is to see that doctor, whereas that does not move. And understanding what they do and how they do it will also help us create better efficiencies in the future. If there are things that we're noticing that could allow their workflow or the work process to be even held in a better manner, then we should. But for us, it is so critical to keep that data stored and keep that patient secure from a situation like the one we saw with the nurses, right? But our biggest fear was, what if that happens? What if an admin had access to being able to pull that file? So we got extremely critical with how we handle our patient access, our patient management, on who can see the files, and especially on what the doctors are doing. With those reports tell us exactly how well managed we were with that patient data. And we can't, like everyone on the call is saying, we can't wait 3 months or 6 months to do an audit. If we're not diligent and we're not on top of it all the time, that's when breaches happen. That's when we can get slapped, and that's when we're the most vulnerable. So it's obviously something that's tedious, but it's something that I enjoy doing because it shows that we're on the right track and that the scalability of it is definitely feasible as we continue to grow.
Absolutely, Ali. And Ali, I still remember that meeting 2 months ago when we started talking a little bit about access management, and you had a Mahatma Gandhi moment where he said, you know what, Ali, I know my doors are locked. I just want to know who has the keys. And that was how you differentiated between security and privacy. So Ali, I think, for someone who's focused on the entrepreneurial side, you've gone slow, but you've asked the right questions, and that's at the heart of security. And again, I do invite our audience that if you get the chance, go onto the Lyte Medical site, visit them on siberXchange.ca, have a conversation with them. Especially here in the Durham region, we have we have a seniors population as well. We have a lot of clinicians, neurovision therapy, a very good example of them, looking to provide services virtually. I highly recommend a conversation at the very least with the team at Lyte Medical. We've got about 25 more minutes left, and a couple of questions have started coming in, and it wouldn't be a session with me if I didn't stitch them and added a little bit of my thought onto them. So Jill, we'll keep the same process. Jill, Ritesh, and then Ali, and then we'll come to a soft landing. Jill, this question has to do with the Canadian context. And I'm pretty sure you're aware of this. I grew up in Dubai, the land of go big or go bigger. And medical tourism at the time was, immense. Folks going from Dubai to India, folks going from the USA to India in some cases. The aspect of traveling or moving or virtually accessing care is not necessarily new. From a global perspective, where do you think Canada stands in terms of privacy and digital care? Are there any use cases or other jurisdictions that you look at and say, this is a good template for us to follow? Jill?
You know, I'm actually going to say that I think Canada is pretty well positioned. You know, I think almost every jurisdiction in Canada, minus one, has standalone health legislation. So we've recently seen some legislative reforms, some new laws in the territory. So I think other than British Columbia, every other province in Canada has health information legislation. So I think that's a pretty good start. They're not all exactly the same. They're probably not even, you know, not the legislation is interoperable, but, you know, we try to get this sort of pan-Canadian thing going where health information can be shared across the country. And there's all sorts of entities out there that are working on things like interoperability between information systems and things like that. I can't speak to every single jurisdiction in Canada. I can certainly speak to the situation in Alberta because many years ago, I was a consultant doing privacy impact assessments in Alberta for physicians and physician offices. There was a provincial government program called POSP, the Physician Office System Program, that made dollars available to physicians and physician clinics to transfer their hard copy patient records to an EMR. And so along with all those dollars came consultants with advice and training and assistance to complete privacy impact assessments. And that was the work that I did long before I became commissioner. And I think that as a result of that, certainly in Alberta, you know, we have a really high percentage of physicians who have electronic medical records and who are, you know, more comfortable now than they would have been 20 years ago when I was doing this stuff. You know, some of them didn't even have internet at that time. They were implementing EMRs. So I think we've come a long way, particularly in Alberta. The infrastructure has been built. The mandatory privacy impact assessments have been here for, well, since basically the turn of the century. Isn't that something to say? So 21 years of mandatory PIAs in Alberta in the health sector. They must be submitted to the commissioner's office. I mean, we've reviewed literally, well, last time I checked was something around 2014, and I think we're at 4,500 PIAs then. So, you know, we get 1,500 PIAs a year now. So it's kind of, you know, this idea of privacy by design and embedding it into the system. It's a pain in the butt. I do get that. But the legislative infrastructure is there. The experience is there. It's built in. It's become routine. I think Alberta is really well positioned. Having said that, we still, you know, we struggle with some things. I mean, the number of fax transmissions that go awry in the health sector continues to drive me crazy. The only place you see anybody using fax machines anymore is in healthcare for some reason. You never see that in the private sector. So I think we're pretty, certainly Alberta's well positioned. I think other jurisdictions are as well. Ontario's also, I think, quite advanced. You know, we're seeing more patient portals where patients can access their own information, which is a fantastic thing to allow. You know, there used to be a lot of fear around that, around patients that won't understand their health information. And as I've already mentioned, there's all sorts of issues. Well, what if they don't keep it safe? And what if it gets into the hands of their family? And I think for the most part, we've kind of moved beyond some of that to recognizing that it's really important for patients to be able to access their own health information, to be able to control that information, to be able to share it as they see fit. And I think Canada is very much a leader in that sort of thing. Just generally in the privacy arena, Canada is really, really well positioned, just because of being a federation, because of the way our laws are developed, because we look to each other and one law builds off another. I think there's a fairly comprehensive, if you know, a bit of a patchwork, but still a fairly comprehensive framework. And you don't see that in, for example, in the United States. You've got some issues there. So yeah, I think we're well positioned. to be able to take advantage of some of these new technologies, which isn't to say that we couldn't benefit from legislative reform. And I think any jurisdiction you went to in Canada, the Privacy Commissioner would say we could have better laws to facilitate information sharing when we want to facilitate information, to make sure that there are protections to prevent that from happening when it shouldn't happen, to make sure that there are real penalties and sanctions for parties that breach privacy, that don't have appropriate safeguards in place. I think most of my colleagues and I would advocate for things like administrative monetary penalties in situations like that. In Alberta, we've had a lot of success in investigating and seeing people prosecuted, charged, convicted of breaches of the Health Information Act. I think we've had 18 or 19 successful convictions so far. I think that's really important. If an organization has all the safeguards in place, they've done the appropriate training, the technical safeguards are there, they've got policies and procedures, people ought to know better, then you're able to show that somebody has deliberately breached the legislation. And so we've completed those investigations. We turn it over to Crown. Crown prosecutes. We've seen fines up to, I think, 15,000, and some individuals who've been prevented from accessing health information for a period of time. All of which is to say, though, I still think that there's room for stronger penalties to really give teeth to privacy laws. And we see that happening globally with GDPR, for example. I think Canada maybe falls behind there, where we sort of rely on people behaving well, following our recommendations. We're mostly successful, but I think there's room for sure for stronger penalties and sanctions. Yeah.
Absolutely.
A bit of a mixed bag. In some ways, I think we're well positioned globally, and in others, we're falling a little bit behind.
Yeah, and I think there are lessons to be learned from numerous practices. The one thing that I can say is there are numerous forums that are emerging where discussions are happening between different jurisdictions, not just in North America but around the world. I know from an AI perspective, and because that's one of the areas I work in, some of the recommendations coming out of the EU, for example, are not lost to us, and we can reference them. And I think that practice of continuous learning is key. Privacy is not a product, it is a process. And I never said that. In fact, Kat Kood, who was the chair of Canadian Women in Cybersecurity, was the one who shared that line with me. We have another 18 minutes to go, and we'll keep the same flow going. Ritesh, I want to bring you into this conversation because there's a question here that I'll reword slightly, but thank you for the audience member for bringing this up. And this has to be with incident response and business continuity planning. When it comes to the telemedicine, the virtual care environment, when an incident happens, taking down your telemedicine portal can result in appointments getting canceled, very critical patients not receiving the attention that they require, so on and so forth. In your opinion, what would constitute a good incident response and business continuity planning philosophy when it comes to delivering virtual care? Fish?
Yeah, that's a fantastic question, and thank you to the individual who asked that. And just before I answer that, I just want to add on to the amazing insight that the Privacy Commissioner gave. I think, to me, the law when it comes to this, and Ali, you mentioned the same thing. It is not the ceiling; it is the floor, right? It doesn't just because the law says one thing, that doesn't mean that you, as an organization, should not be trying to achieve more than that. Like that's not like a threshold or a barrier. It is literally the floor to say that you're in compliance. But what makes you a good company, what brings value to the end user, is everything in addition to that you do. I think is I think that's worth mentioning. But to answer the question, so in incident response, you take down an app, and now all of a sudden you're not able to get your bookings, you're not able to access healthcare. Well, the reason you're not able to access healthcare and access your bookings is because you didn't build in a contingency plan from the beginning. So what happens when the lights go out? It's the same thing of what happens with respect to COVID, and a lot of us not having plans in place of what is a contingency if our door shut down. The best example I could give is we all practice fire drills. right? The fire drill goes off. We know exactly what to do. We have a plan. We practice it. We have fire drills. We don't really hold cyber drills, and we got to hold cyber drills as well as an organization. So when you have a plan, and it depends again with telemedicine, it is do you have a backup phone number that people can call into? Is it staffed 24/7? Do you offer, if you offer your services in English and in French, now all of a sudden, if your call center is only in English as your backup line to ensure business continuity, well, you have a problem, right? You're not giving people the services that they expect. If you don't have backups, like let's say your portal ends up getting your system ends up getting hit with ransomware. Well, did you already have encrypted backups so you can have you can get backup and running right away, or are you now and I'm against paying ransoms because you're funding organized crime. There's no guarantee they're going to come back and give you the data or further extort you as well. So there's just so many question marks. But you don't have if you don't have a backup, like what are you going to do with that individual's data? What are you going to do if that data is now actually acquired and sold on the dark web or on some different forums? And this all starts with having a plan, thinking about the worst case scenario. You kind of plan for the worst and hope for the best, right? And I truly believe that, have those. We practice the fire drills, practice those cyber drills, have those plans, have those backups, and think about what happens when the lights go out. How do you have business continuity so you're not scrambling in the last second to have that bandage approach to stop the bleeding? I think that is, and every organization, every team is different. When it comes to telehealth or remote care, again, there's just so many different elements to it, but the fundamental principles are the same.
Absolutely. So, moral of the story or lesson learned: in the event that you need to plan for a breach, call Ritesh, and he has a playbook for all of this and will keep you on point with what you need to be doing. With all of that said, Ritesh, we've got another 8 minutes left, and Ali, I'll bring you into the conversation, and we'll have some closing comments from each of you. And I know we could talk a lot more about this subject. Ali, when it comes to virtual care, one of the things that you've also worked on and are starting to implement with some of your partners is you've got this philosophy, which is see your doctor online and get your meds delivered to your door within a couple of hours. Two things have emerged from this. Number one, you've looked at physical security also as a part of your security posture. And number two, you've looked at training. One of the things that you've done, so just for our audience, a very quick 10 seconds promo on the application that they have integrated into their EMR, is the ability to actually have the doctor or the clinic send a note to your pharmacy where your insurance sits, have them prepare your medication, and then the pharmacy in an Uber-like model is able to select a driver that can deliver your meds to you. One of the things, Ali, that you focused on is on the training and the vetting of those drivers, police checks, making sure everything is in place, tracking the order, so on and so forth. Can you talk to us a little bit about why has that been so important to you, and how have you gone about doing some of those procedures?
Yeah, so it's yeah, we came together, Ali, and figured out the best way to kind of interview, hire, and put them through this process. The reality is that the medication that they're picking up could be extremely valuable or critical, or that you're not really messing around with bubble gum and chips here. So we need to go through a serious vetting process to make sure that these people are, one, not criminals, two, are good at what they do, and three, will never have any liabilities towards any people in the process. Remember, there's a doctor involved, there's our company involved, there's a driver, there's a lot of hands that this touches. So the people that we do bring in have to fit the mold extremely well, otherwise they won't fit the program. For us, it's always been about whether it comes to these drivers or people that work on the platform, it's the same thing. We're always looking for good people, and we have to screen extremely aggressively because of the valuable content that they have in their hands. So for us, we've always been really diligent. We've got a great screening process, and then working with the right applications to make sure that all those screening measurements that we put in place are met. So for us, it's always just about finding the right people and then being really diligent with the way we screen. And again, a lot of this is because as an entrepreneur, I'm always looking for better ways to make Canadians' lives better. So my whole goal is healthcare. Is when we got into healthcare was better access to doctors for Canadians and not having to wait the 2 weeks to see your family doctor. And then again, as we continue to go down the line and figure out how can we continuously enrich Canadians' health, Canadian citizens' healthcare, this came about. And then with that, of course, every time we touch anything, there's a massive amount of security put behind it. So it's just a matter of being more diligent, being more aggressive with our screening, especially understanding what they are handling and what they are delivering. So it's been fun though. The process of being able to see your doctor and get your meds within a few hours, I think, has been one of the things that have allowed for higher adoption rates. You know, it didn't make sense to me. If you could see your doctor from home, then why do you have to travel to go get your meds? It just there's still so much more, I think, that's going to come out in innovation in this space. And then throughout all that, we're going to need both Jill and Ritesh and many more others to make sure that the things that we're doing are more than secure for Canadians and our users.
Well, you know what? Thank you about thinking of Canadians, and thank you about thinking about me, because when you mentioned bubblegum and chips, you had me at bubblegum and chips. So thank you, Ali, for that comment. Anyways, we have about 6 minutes left, and if my math serves me right, I'm going to give you each 2 minutes. Yes, 6 minutes. I'm going to give you each 2 minutes to answer one final question. A couple of them have come in, but Ritesh, how about this? I'll start with you. We'll go to Ali, and then we'll close off with Jill. Ritesh, this question has to do with third-party vendors, especially as a clinic. So I'll read it verbatim. I am a doctor. I have my own clinic, and I'm evaluating some services that I want to bring on. What are some, especially from a telemedicine perspective, what is some advice that you can give me when it comes to vendor management and telemedicine? Ritesh?
That's a fantastic question, and thank you to the doctor for submitting that question. So again, it depends on what you're trying to accomplish. So there is, this is not kind of like a checklist, but I can give you some high level information that you need to be asking about. So first of all, do your homework and know who the vendor is. And it's important to read those reviews, to go on their website, to see if they're legitimate, to look them up. There's vendors popping up left, right, and center, which is a good thing. I foster the innovation startup community. I think this is fantastic, but at the same time, they might not be thinking about privacy. They might not be thinking about security. You might be their first customer. And so, do your homework. I think that's number one. Number two is you want to ask about where that data is being stored, what is being stored, who has access to it, how will they access it. I think that is very important. There might be rules, laws around where that data can, where certain type of data can be stored. There needs to be logs. So you need to be cognizant of that based on your province, based on what services that you're providing, and clearly the sensitivity of the information, because I'm assuming this is patient-related information. You need to have security protocols in place. So you yourself understand that the devices that you're using are secured themselves, and kind of teach that to your staff as well. So if you're using these different platforms, as you might not be the only one who has access to it. There might be people from HR, there might be people who have other admin accounts, there might be analysts, for example, who get access to this type of data. Work from home is a big thing. So do you actually have a containerized ecosystem available of where this data is being accessed, or can somebody simply just pop in a USB key and hit export and all that data is gone? So can you identify that? If the answer is no, if you haven't thought these things through, we get back to kind of doing your homework. And this kind of speaks to exactly what the Information Privacy Commissioner mentioned on just basic cyber hygiene when it comes to this, the multi-factor authentication, the using of the strong passwords, all that stuff is very important, kind of ingraining this culture of security and privacy right into your organization. So if you do that, if you do your homework, ask about the data. The data is critical. Ask them about the security protocols. Ask them about who their other customers are. Call those other customers. Get a trial run. Put in some sample data. Test it out. And then make a determination. But what you shouldn't do is just take the software, take it as, take their marketing material and think that it's all accurate, and without vetting it, and just go ahead and use it. That is not the way. And I believe if you're also in most provinces, you also got to do a PIA, which would be the bare minimum before you do implement any type of technology in the within your organization. So follow that. It's not a complete checklist. It depends, but that should give you a little bit of guidance.
Absolutely. Now, I will say this very quickly, although we don't have enough time for you to respond. There was a question that came up about quantum computing and different cryptographic techniques. Thank you to Bev from IronCap for asking that. Ritesh, if you have a moment and you can go into the live chat on siberexchange.ca after this session, could you please make sure you respond to that? A lot of questions have come direct message to me. So Bev will make sure that Ritesh answers that one from a quantum perspective. Ritesh, thank you so much for your time. We've got 2 minutes each. Ali, we'll start off with you. I honestly think this was my mom. I think she's online because the question explicitly reads, can my kids use your EMR and telemedicine platform? But I guess what they're referring to is from a guardian's perspective. Have you factored that in terms of how somebody can represent someone on your platform? Ali?
Yeah, so we do. We have dependents. So we have the ability to add dependents onto your account. So the mother can watch for the child. They can have them under their patient profile so they can monitor it as well. There does need to be consent and guardian consent when it comes to children under the age of 18. But yes, absolutely. For us, there's no limitation to who we will see. We have doctors that specialize in working with children. This is what we do. So absolutely yes. And it's there in our platform itself. There is the ability to have dependency, so you'll be able to book your appointments for your child. You'll be able to monitor how they're doing. If they're on a program that needs to be tracked, they'll be able to monitor that as well. So absolutely, yes, it's meant for Canadians of all ages. Please don't hesitate to use it. You have a tickle in your throat, use the app. We're trying to get to preemptive healthcare where we're not overwhelming our hospitals and our emergency rooms with things that can be handled potentially over a call if we attacked it earlier. So we encourage you. You have a tickle in your throat. Something's not right. Speak to a doctor. Let's take care of that before it becomes something overwhelming or outrageous. Don't be shy.
Fair enough. Thank you so much, Ali. And Mom, if that really is you watching, when I left Dubai, you said, as long as you don't appear on the Jerry Springer show, you're good to go. I'm on a very important cybersecurity show, so hopefully you are proud of me. Final comment goes to Jill. And Jill, from your perspective, in terms of trends in healthcare and privacy and security, so on and so forth, what would you say is one of the top concerns that keeps you awake in terms of where we're headed to in this new norm? Jill, final comments to you.
Oh, okay. What keeps me awake at night? Well, so many things do, really. But actually, I might turn that around, Ali. I think that I feel quite optimistic. We see, well, especially in Alberta, we've had mandatory breach reporting in the private sector since 2010. So I've seen a lot of breaches come in, and we've had mandatory breach reporting in the health sector since for 3 years now, I guess. So 2018 anyway. So I see lots of breaches there as well. I think that I could let that really get to me and keep me up at night looking at breach after breach after breach after breach. But I think I'd rather turn it around and say that, what I see more so is an awareness of the importance of privacy, and certainly in the health sector, an awareness that trust is absolutely foundational to patients going forward and embracing these new technologies. And what I see are health custodians who are thoughtful about the systems they implement, who do their due diligence, who, as Ritesh was saying, who go above and beyond basic privacy compliance, who are thinking about these issues. I think some of what we saw as a result of the pandemic, this accelerated adoption of new technologies, a lot of that was coming anyway. It was just moving a lot more slowly. And so I feel quite enthusiastic about how it's rolling out. I think some early glitches and again, the sort of stop the bleeding. How do we just sort of keep going here? But it's settling. And I think, so my early fears, let's put it that way, my early fears that, this is the Wild West and everything's just going crazy and it's blowing up all over the place and this is going to be a disaster. I think there's a lot of really, really good work that is going on out there. I think there's a lot of attention being paid to these issues. I think there are a great many really good actors. The breaches happen. The bad guys are out there. The ransomware attacks continue. What I don't see a lot of is, other than, on individuals, we still see a lot of authorized users who misuse access and they snoop for curiosity or to look people up. And there's not necessarily, I don't think you can ever get rid of all of that. But I do think there's a lot more awareness. There's a lot more sort of putting patients at the center of things and understanding that it's their information. They should have control over it. You've got to be transparent. Yeah, I think a lot of that is going in the right direction. So yeah, not quite the right answer maybe, or the answer you're looking for. Instead of what keeps me up, it's sort of what did keep me up. I did have a lot of worries. I do see a lot of positive work going on. So I'm actually feeling quite optimistic. I think it's these technologies are fantastic. And you think about, I have elderly parents in their 80s, and they're having Zoom calls with their doctor, and I'm warning them about encryption and what about this and what about that and what if you're Zoom bombed, blah blah. And they're kind of, well, we don't really care if our health information is out there. That's my parents, other people have, but I think it's fantastic that they don't actually have to go out in a pandemic when their health is at risk, and that they can actually connect with their long-standing healthcare providers. It's fantastic stuff. So let's just do it properly, thoughtfully, and think about privacy, embed that in there from the very beginning. And that will help prevent nightmares for all of us, I think.
Absolutely, and I think with the positive approach that you're taking, it will breed an ecosystem for innovation in healthcare as well. And I know Ali and Ritesh, you two have major roles in that, advising companies, growing your own companies, doing so much more. But with that, Jill, Ritesh, Ali, I'm going to ask you just to stay on when we go offline, just for 30 seconds, so we can brief. But I do want to thank you once again. I know firsthand, Ali, we're working with you through the college, your schedule, Ritesh, you as well, and all of the achievements. I'm just waiting for your next Bollywood release to happen, but an extremely busy individual. And Jill, of course, as Privacy Commissioner, you have a lot on your shoulders, and I really appreciate the fact that I was able to email you directly, and you reached out within less than 24 hours saying, I'll make the time for it. So thank you so much for making the time. Truly appreciate it. So please stay on until I say that it's safe to head off offline. But to our audience, tomorrow is the final day of siberXchange 3.0. I will join you at the opening talk show and then take my leave, as I have to go to teach. There's been so much learning that we've achieved. Tomorrow, we'll be looking at the education sector, and you'll be met with folks such as the CIO from Laurentian University, the CISO from Ontario Tech and Durham College, the Vice President of IT from Thomson Rivers. A lot of individuals giving you perspective from an education standpoint on what's happening in cybersecurity. Please feel free to join in tomorrow sharp at 10 a.m. EST, and then we'll be closing the conference at 4 p.m. with closing comments from our chair and co-chairs. With that, I ask all of you to stay safe and stay healthy. And if there's one thing that I learned from this session, it's around trust. When it comes to trust, don't trust everything that you see. Even salt looks like sugar. If you're questioning my eyesight, I'll try and see a doctor on the telemedicine portal called Lyte Medical Clinics. Thank you for sponsoring this session. Everybody stay safe, stay healthy.